No,
Sorry?
where and when and how did it everything begin?
Right. It began in 2012 with an approach from the government in Bhutan, the educational
Oh,
ministry. They had just completed the two-stage disability survey. It was the first survey in the entire country that tried to enumerate and understand what is the actual population of children with
okay.
disabilities. And although it wasn't as yet published, they themselves knew that they were looking at, of course, a largish number. And when they looked at their educational services, although they were already providing inclusive services, one of the most advanced visionary countries in this way, they had no plan for children who were more complex. So that was our first entry to do a sort of nationwide survey. It was an amazing experience. I traveled with the chief of the special ed department, and it was amazing to me this level of connectedness, commitment from a national government, willing to go into schools across the length and the breadth of the country. Education look like? What does it mean if a child is more profound? We stopped on the way as people asked us if they heard about a child with a disability. We stopped, all of us, ministry as well as I, and met with families. So it was a very rich and strong initial engagement. It took a while for us to finally work out all the plans, but 2017 is when we started a formal engagement trying to work systematically to develop inclusive services across Bhutan.
Oh, wow. But what were the challenges you faced in making inclusion possible, a reality both in India and in Bhutan?
Well, in Bhutan, I'll tell you, the lack of role models was really something. It's it's very hard. They are a very unique country with unique challenges, and although I can draw similarities, let's say, from our Himalayan states and the solutions that we've constructed, everything that
Please go
we
on.
would like to provide as a look, this is possible. On the other side, where they say, so for that, especially at the beginning, to say, I can see the possibility. I've done this work now for many, many years across many, many different countries without resources, without expertise, and I know it can happen, but I know they don't. So that breaking that initial barrier to help them see and be really excited, not just doing it as an obligation or because it's in a policy, but because they can see it's possible. That excitement, if you can incite, then a lot of the problem solving will come from within them, which is ultimately what we want, isn't it? That a nation or a people or a program or a parent understands their own capacity to solve a problem and has a really strong belief of. So doing that without having in-country examples, of course, yes, visual impairment, yes, just started with hearing impairment, yes, a couple of people with accidents or polio, some sort of locomotor difficulty, and yes, a couple with nonverbal cerebral palsy, more profound, more complex, but not followed an educational path. So the primary question, what am I supposed to do as the educational ministry? What should it look like when you're 5 and 6 and 12 and 14? right? So that vision for what it could be was, I would say, the biggest challenge to get started.
Oh, but now today, COVID-19 has changed life dramatically all over the world. Now, how has this impacted your
Yeah.
work? How do you
In
cope with this?
Bhutan, yeah, it's been really dramatic. But I've been thinking about this. In If I look back on the last couple of months, it's in many ways been a blessing. It's pushed us to think differently. It's pushed us to respond differently. And in a way, it's enabled people and programs to see their own capacity. It's also interestingly created, this year we had committed to the government to help them with an in-country person to help develop and demonstrate actual inclusive teaching plans that were meaningful to a child with a more complex disability, leading to a real future that was created in partnership with parent and so on. So the way we had designed the whole year involved this person living in country for a period of the year, working in a school, working with families and the teachers, and demonstrating the outcome. Well, as soon as the schools opened, because the academic year in Bhutan goes from February to December, pretty much as soon as the schools opened, they all closed. So, what was she supposed to do? She was there. The first training was done. She had started meeting the children. So, we literally flipped the plan completely. And we started by saying, here's the model. Let's go do it. Just trust us.
Oh,
Just go with it.
oh my.
And
my.
yeah, it was scary. And it was incredible amount of work. I cannot tell you how much of work it took, but it meant like a fast forward to the end of the year, work directly with teachers and families, and start developing plans that get implemented at home. So no internet, no parent working outside, child living with grandparent, all kinds of issues. You just deal with it because you're there. We have time. The kids need it. The families need it. And although we've just started, I'll say this: immediately the parents are seeing the difference. Immediately, parents are starting to understand their own capacity. In fact, much faster than the schools or the teachers who are still so overwhelmed with this new responsibility and new way of reporting and planning and teaching. The parents, because we started implementing the program, are so excited and so encouraged that I feel that even if nothing else comes through by the end of this year, having that group of families who have experienced success, this group will push back at the limitations that are in place in any educational system in the world and make sure that something happens for their kids. So this has been like the big difference. It's not us, the experts, the trainers, the knowledgeable, able ones, going in and providing the services. We are doing the bare minimum. We are saying, here's an idea, try it out. I'll show you, I'll watch you, I'll help you. But you have to do it. I can't come. I'm not allowed. And they've just being able to get them to start and then seeing where it's taking their kids. This is fabulous. It's been lovely. So I think,
Wow.
yes, there have been big challenges. We are learning to do things remotely. I have a training coming up, requested by a parent group, organized by them because of their concern. FENSIM is a group of parents. who've come together to support the possibility of their children studying meaningfully in schools, in regular schools. Um, and they've asked if we can run a series of trainings for parents and teachers. I'd love to. I have to first learn how to. So I'm sort of figuring it out right now, because you want to do it soon. And, we also have our challenges of our technological capacity, that we're used to training in a certain way. And I feel like I have to remove my head and bring a new one in place. I don't know how to do this effectively, and I'm so glad that they're willing to try with me. I don't know. This is the best we can do, but I think it's exciting. I think it opens so many possibilities for functioning. Imagine that, right? That you can reach people in a very different way, but if we can do it effectively, why not? Why not? Isn't it?
Wow. Your work in Bhutan is ongoing, but based on your
Yes.
experience so far, what are the takeaways that can be applied to other contexts, especially in India, for example? What?
Well, I have to say, I am filled with praise for the ministry. I have watched this country, from multiple angles,
Mhm.
from the level of the government, the policy development, the research, etc., that they are putting in place, the process of law development. They recently put out their policy on disability, curriculum development, many aspects at that level where services and systems are being developed. And at the same time, I'm working directly with families, with young adults. So we are experiencing their process from multiple angles. I know that being a family in Bhutan, where there really are no services, there is no expertise, there's no course, so there's no foreseeable future for in-country expertise to develop. And yet, the thoughtfulness, I know that it's frustrating. You want your ministry to decide tomorrow, implement day after. It doesn't work that way. It's an entire nation. It takes time. I appreciate that. But the thought and the way they respond is something I really admire. Having worked with governments in many countries, including ours, they were systematic in their approach, right from how they collected data, how they processed that data, what they did with the data. They didn't immediately come up or just pull out policy from the air. They invited people in. They went through a 2-year process where they educated themselves. They went through all levels of ministry, public affairs, you know civil management, building, what have you. Everybody has sent someone and gone through this disability perspectives training before the policy was even drafted. Now this, Jayshree,
Okay.
do we really do we really do this? Do we think systematically and allow every department and every angle to have a voice? I think this is something truly to appreciate about the way the nation has functioned. They keep everything together: economics, finance. It's as we all say we do, but we certainly don't. You know, so this is
I'm,
something I really think. I see the government in Bhutan reaching out to other governments and learning from others and so on. And I think it's time we went and learned from them.
Your work is absolutely mind-boggling. Really, the disability sector needs so many more people like you. Thank you. Thank you once again
Thank
for
you.
your time. Thank you for being with us, Namita.
Thank you so much. I think I'm very lucky in the kind of work I do, that I get to travel and to see life in many countries.
Thank you.
That's a privilege. Yeah. Thank you. Thank you, Jayshree.